Hello everyone. So many people ask me this question, how does an osteopath exactly treat? So today I'm going to answer that. So osteopaths are actually the primary care physicians of the community. They rely on three main modalities. First is the vocal, second is the visual, and third is the palpatory or perceptual skills. In vocal, osteopaths rely on history taking. We have a detailed history taking which may take around 15 to 20 minutes, where we ask the complete detail regarding the chief complaints of the patient, then the past history, any surgical, accidental history, or any medical history like diabetes, blood pressure, and history of in women menstrual and obstetric history, and drug history if this patient is taking any drugs, any history of jaundice, or dental history, birth history, how was the birth of the patient, like C-section or normal delivery, forceps or vacuum delivery. Then we ask the personal history of the patient, how is their digestion, their sleep, their appetite, their breathing habits. Then we come to a we get a proper detailed case history of the patient, and then we move to a second skill, which is the uh, visual skills. In visual skills, which include the physical examination of the patient, where we check the posture of the patient, how the patient is sitting, how are they standing, how are they walking, how is the movement of their body when they are walking, the movement of their shoulders, their pelvis, their spine, how are they swinging their legs. And we check all these things. How is their foot? Is it flat foot or it's a normal curvature? And we check their breathing. Are they able to breathe properly? Is there any restriction in the breathing when they are breathing? Are they doing abdominal or thoracic breathing? Then we get a proper visual diagnosis of the patient. And third is the perceptual or palpatory skills, where we use our hand. Osteopathy is a completely manual technique or manual treatment, so we use our hands to examine the spine, the spinal curvature, how is the health of the spine, how is the movement of each vertebra of the spine, how is the movement of the joint. We check the mobility, motility, and functionality of each joint of the body. So not just the musculoskeletal, but also the visceral or the organ part, which includes the digestion, our different organs, how are they working, how is our stomach, how is our liver, how are the intestines, how is the peritoneum. We check all these things. How is the diaphragm? Is the diaphragm expanding properly or not? And last but not the least, how is the breathing? And also we check the cranium, head, where we check for the primary respiratory mechanism, in which we check the movement of the cranial bones and the overall health of the body, the movement of the fluids in the body. So here we use these three modalities, that is the history taking, which is the vocal skills, the visual skills, and the this palpatory skills to come to a proper diagnosis. The diagnosis we compare to our chief complaints and we use our best of the abilities to reach the root cause of it. And then we treat. So how do we treat? So osteopaths rely on the osteopathy manual techniques, which are general osteopathy techniques, where we manipulate each joint of the body, the appendicular joint, the shoulder joint, the hip joint. Then we have HVLAs, then we have gentle spinal manipulation and other joint manipulation. We do visceral manipulation with our hands, and we have soft tissue massage, we have muscle energy techniques, we work on the cranium using the cranial osteopathy techniques, etc. So after that, when the treatment is done, the whole procedure takes around 45 minutes to 1 hour. When it is done, we give around 5 to 7 days for the patient to recover, and we see how they are responding to the treatment. During this period, we advise them some special special diet, some exercise, yoga, so it will speed up the recovery process. Now that is how we treat. Usually we call the patient for follow-ups in like 5 to 7 days, depending on different patient and different case. And then we osteopaths, we may advise imaging, we may advise blood test, and usually we don't advise any medication, sometime painkiller if it is like paining a lot, but we avoid advising any kind of painkillers. We make sure their vitamin D and vitamin B12 levels are normal, because that is very important in the recovery process. Yeah, so that's how we treat. And osteopathy is not just restricting ourselves to the physical body. We work on the mental, spiritual, and emotional aspect of the patient also, because after the osteopathy treatment, when the nervous system and all is completely relaxed, the autonomic nervous system is balanced, the patient feels very relaxed, calm, and composed. So that is how we just don't restrict ourselves to the physical aspect, but we work on the all three dimensions, that is physical, mental, emotional, and also the spiritual aspect. Thank you so much.